Which layer of the heart is responsible for the contraction of the heart muscle? A. Endocardium. B. Myocardium. C. Epicardium. D. Pericardium. The correct answer is B. The myocardium is the muscular layer of the heart responsible for its contraction. Which of the following statements about cardiac output is correct? A. It is the volume of blood ejected by each ventricle. B. It decreases during physical exercise. C. It is solely determined by heart rate. D. It is unaffected by stroke volume. The correct answer is A. Cardiac output is defined as the volume of blood ejected by each ventricle, calculated as heart rate multiplied by stroke volume. During the cardiac cycle, what occurs during diastole? A. Ventricles contract to pump blood. B. Atria fill with blood. C. Blood is ejected into the aorta. D. The heart's electrical activity is at its peak. The correct answer is B. During diastole, the heart muscles relax, allowing the atria to fill with blood from the veins. What is the primary function of the sinoatrial SA node in the heart? A. To initiate the contraction of the ventricles. B. To regulate blood pressure. C. To act as the primary pacemaker. D. To distribute electrical impulses throughout the myocardium. The correct answer is C. The sinoatrial SA node is known as the primary pacemaker of the heart, initiating the electrical impulses that trigger heartbeats. Which type of blood vessel carries oxygen-rich blood away from the heart? A. Veins. B. Capillaries. C. Arteries. D. Venules. The correct answer is C. Arteries carry oxygen-rich blood away from the heart to the tissues. With the exception of the pulmonary arteries, which carry deoxygenated blood to the lungs. What is the role of the autonomic nervous system in heart regulation? A. It completely controls heart muscle contraction. B. It influences heart rate and force of contraction. C. It has no effect on heart function. D. It only regulates blood pressure. The correct answer is B. The autonomic nervous system influences heart rate and the force of contraction through sympathetic and parasympathetic pathways. Which component of an electrocardiogram ECG represents ventricular depolarization? A. P wave. B. QRS complex. C. T wave. D. U wave. The correct answer is B. The QRS complex on an ECG represents ventricular depolarization, which triggers ventricular contraction. Which of the following is not a factor affecting blood pressure? A. Cardiac output. B. Vascular resistance. C. Blood volume. D. Heart rate variability. The correct answer is D. Heart rate variability is not a direct factor affecting blood pressure. The primary factors are cardiac output, vascular resistance, and blood volume. In which part of the heart does the blood receive oxygenated blood from the lungs? A. Left atrium. B. Right atrium. C. Left ventricle. D. Right ventricle. The correct answer is A. The left atrium receives oxygenated blood from the pulmonary veins coming from the lungs. What condition is characterized by a persistent increase in blood pressure above normal levels? A. Hypotension. B. Hypertension. C. Ischemia. D. Aneurysm. The correct answer is B. Hypertension is defined as a persistent increase in blood pressure above the normal range, posing risks for cardiovascular diseases. Which of the following blood vessels is the primary site for the exchange of gases, nutrients, and waste products? A. Arteries. B. Veins. C. Capillaries. D. Arterioles. The correct answer is C. Capillaries are the primary sites for the exchange of gases, nutrients, and waste products between blood and tissues. Which structure connects the atria and ventricles in the heart? A. Atrioventricular, AV. Valves B. Semilunar valves C. Chordae tendineae D. Coronary arteries. The correct answer is A. The atrioventricular AV valves mitral and tricuspid connect the atria and ventricles, preventing backflow during contraction. What effect does the sympathetic nervous system have on heart function? A. Decreases heart rate. B. Increases heart rate and contractility. C. No effect on heart rate. D. Increases vagal tone. The correct answer is B. The sympathetic nervous system increases heart rate and contractility through the release of norepinephrine. What does the T wave in an ECG signify? A. Atrial depolarization. B. Ventricular repolarization. C. Ventricular depolarization. D. Atrial repolarization. The correct answer is B. The T wave represents ventricular repolarization, indicating the recovery phase of the ventricles. Which of the following best describes the cardiac cycle? A. The sequence of events in one heartbeat. B. The duration of the heart's electrical conduction system. C. The process of gas exchange in the lungs. D. The total volume of blood in the circulatory system. The correct answer is A. The cardiac cycle is the sequence of events in one heartbeat, including diastole and systole. What is the primary function of the coronary arteries? A. To supply blood to the lungs. B. To supply blood to the heart muscle. C. To drain blood from the heart. D. To transport oxygenated blood to the body. The correct answer is B. The coronary arteries supply oxygenated blood to the heart muscle itself, essential for its function. Which type of circulation involves the delivery of deoxygenated blood to the lungs? A. Systemic circulation. B. Pulmonary circulation. C. Coronary circulation. D. Fetal circulation. The correct answer is B. Pulmonary circulation is responsible for delivering deoxygenated blood to the lungs for oxygenation. Which condition results from the narrowing of coronary arteries, leading to reduced blood flow to the heart muscle? A. Myocardial infarction. B. Angina pectoris. C. Heart failure. D. Arrhythmia. The correct answer is B. Angina pectoris occurs due to narrowing of coronary arteries, resulting in reduced blood flow and chest pain during exertion. The Frank-Starling law of the heart states that A. Increased venous return leads to increased stroke volume. B. The heart rate is constant regardless of demand. C. Blood pressure remains unchanged during exercise. D. Cardiac output is independent of heart rate. The correct answer is A. The Frank-Starling law states that the greater the volume of blood entering the heart, increased venous return, the greater the force of contraction, leading to increased stroke volume. Which factor does not affect heart rate? A. Age. B. Fitness level. C. Body temperature. D. Skin color. The correct answer is D. Skin color does not affect heart rate. Age, fitness level, and body temperature can all influence heart rate. What is the primary purpose of the valves in the heart? A. To increase heart rate. B. To allow bidirectional blood flow. C. To ensure unidirectional blood flow. D. To control blood pressure. The correct answer is C. The primary purpose of the heart valves is to ensure unidirectional blood flow, preventing backflow during contractions. What is the significance of the PR interval on an ECG? A. It indicates ventricular repolarization. B. It reflects the time taken for electrical impulses to travel from the atria to the ventricles. C. It shows the duration of ventricular systole. D. It represents atrial depolarization. The correct answer is B. The PR interval reflects the time taken for electrical impulses to travel from the atria through the AV node to the ventricles. What is the main role of the pulmonary veins? A. To carry deoxygenated blood to the lungs. B. To carry oxygenated blood from the lungs to the heart. C. To drain blood from the heart. D. To supply blood to the body. The correct answer is B. The pulmonary veins carry oxygenated blood from the lungs back to the heart's left atrium. Which type of heart failure occurs when the heart cannot pump effectively to meet the body's needs? A. Diastolic heart failure. B. Systolic heart failure. C. Acute heart failure. D. Congestive heart failure. The correct answer is B. Systolic heart failure occurs when the heart's ventricles cannot pump effectively, leading to insufficient blood supply. What effect does an increase in stroke volume have on cardiac output, assuming heart rate remains constant? A. Cardiac output decreases. B. Cardiac output remains the same. C. Cardiac output increases. D. Cardiac output fluctuates. The correct answer is C. Cardiac output is calculated as stroke volume multiplied by heart rate. If stroke volume increases while heart rate remains constant, cardiac output increases. Which part of the cardiac conduction system is responsible for conducting impulses rapidly through the ventricles? A. Bundle of His. B. Purkinje fibers. C. SA node. D. AV node. The correct answer is B. Purkinje fibers conduct impulses rapidly throughout the ventricles, ensuring synchronized contraction. Which hormone is released during stress and increases heart rate and contractility? A. Adrenaline. B. Insulin. C. Cortisol. D. Serotonin. The correct answer is A. Adrenaline, also known as epinephrine, is released during stress and stimulates increased heart rate and contractility. What is the main difference between arteries and veins? Arteries carry blood away from the heart, while veins carry blood to the heart. Arteries have thinner walls than veins. Veins have valves, while arteries do not. Arteries are larger than veins. The correct answer is A. The main difference is that arteries carry blood away from the heart, while veins carry blood back to the heart. What is a common symptom of myocardial infarction? A. Severe headache. B. Chest pain or discomfort. C. Fainting. D. Nausea without vomiting. The correct answer is B. Chest pain or discomfort is a common symptom of myocardial infarction, heart attack. Often described as a pressure or squeezing sensation. Which of the following best describes hypertension? A. A temporary increase in blood pressure. B. A chronic condition characterized by elevated blood pressure. C. A decrease in blood volume. D. A condition affecting only the elderly. The correct answer is B. Hypertension is a chronic condition characterized by consistently elevated blood pressure, increasing the risk of cardiovascular diseases. What is the function of the atrioventricular AV node in the heart? A. To initiate the heartbeat. B. To delay the electrical impulse before it enters the ventricles. C. To distribute impulses throughout the atria. D. To connect the atria and ventricles. The correct answer is B. The AV node delays the electrical impulse from the atria before it travels to the ventricles, allowing for proper filling of the ventricles. Which measurement is primarily used to assess the efficiency of the heart's pumping ability? A. Blood pressure. B. Ejection fraction. C. Heart rate. D. Pulse oximetry. The correct answer is B. Ejection fraction measures the percentage of blood pumped out of the ventricles with each contraction, assessing the heart's pumping efficiency. What does a heart murmur typically indicate? A. Normal heart function. B. Valve abnormalities or turbulence in blood flow. C. Arrhythmias. D. Myocardial infarction. The correct answer is B. A heart murmur often indicates valve abnormalities or turbulence in blood flow, which can signify underlying heart conditions. Which condition is characterized by the formation of plaques in the arterial walls, leading to narrowed arteries? A. Atherosclerosis. B. Angina. C. Arrhythmia. D. Cardiomyopathy. The correct answer is A. Atherosclerosis is characterized by the buildup of plaques in the arterial walls, narrowing the arteries and restricting blood flow. Which part of the heart wall contains specialized pacemaker cells that initiate the heartbeat? A. Endocardium. B. Myocardium. C. Epicardium. D. Pericardium. The correct answer is B. The myocardium contains specialized pacemaker cells, primarily located in the SA node, that initiate the heartbeat. What is the significance of the ST segment in an ECG? A. Atrial depolarization. B. Ventricular depolarization. C. Ventricular repolarization. D. Ischemia or infarction. The correct answer is D. The ST segment is significant for identifying ischemia or infarction. Deviations can indicate cardiac issues. What is the primary cause of congestive heart failure? A. Aging. B. Myocardial ischemia. C. High cholesterol. D. Dehydration. The correct answer is B. Myocardial ischemia, often due to coronary artery disease, is a primary cause of congestive heart failure, leading to the heart's reduced ability to pump effectively. Which of the following best describes the role of the vagus nerve in heart function? A. Increases heart rate and contractility. B. Inhibits heart rate. C. Has no effect on the heart. D. Regulates blood pressure directly. The correct answer is B. The vagus nerve inhibits heart rate through parasympathetic stimulation, leading to a decrease in heart rate. Which of the following describes the relationship between heart rate and stroke volume in a healthy heart? A. An increase in heart rate always leads to an increase in stroke volume. B. Heart rate and stroke volume are independent of each other. C. An increase in heart rate can lead to a decrease in stroke volume. D. Stroke volume is constant regardless of heart rate. The correct answer is C. An increase in heart rate can lead to a decrease in stroke volume due to insufficient filling time for the ventricles. What cardiac condition is characterized by the heart's inability to pump sufficient blood to meet the body's needs? A. Myocardial infarction. B. Heart failure. C. Arrhythmia. D. Cardiac arrest. The correct answer is B. Heart failure is a condition in which the heart is unable to pump enough blood to meet the body's needs, resulting in symptoms like fatigue and fluid retention.